Medicare Advantage or a Medicare Supplement plan, also known as Medigap. It's literally the biggest fork in the road when it comes to Medicare, and most people agonize over it incessantly. So, let's make this as simple as we possibly can. For the next 8 to 10 minutes, I'm going to explain to you what Medigap or Medicare Supplements are and what a Medicare Advantage is as well. Now, I'm not going to tell you exactly which one to pick because that decision is on you and it basically falls underneath what your lifestyle looks like and what you want it to look like going forward. But I will show you exactly how each one of them works so you can make an informed decision. By the way, my name is Joel. I'm a licensed Medicare educator, agent, if you will, and also a software engineer by day, which means I like explaining a lot of complicated stuff and making it feel very, very, very simple. So without further ado, let's break this all down. Now, before we go any further, I want you to remember something very, very simple. Remember this as the foundation, if you will. Original Medicare is parts A and B, and it covers a lot, but not everything. And it has no yearly limit on what you could potentially pay for that year in terms of your healthcare costs. So once you have parts A and B, most people almost always add something onto that to limit their exposure. And that, my friend, is the fork in the road, where we have Medigap on one side and Medicare Advantage on the other. Two different roads. Let's talk about each. And let's start with Medicare Supplements or Medigap. Now, again, Medigap or Medicare Supplements sits on top of Original Medicare and helps pay for the gaps that Original Medicare literally leaves open. So the deductibles and co-insurance Original Medicare leaves to you, that then gets taken care of by Medigap. Now, the way that it generally works, you will keep Original Medicare and you can see any doctor in the country that accepts Medicare. No networks, no referrals, and the supplement picks up much of what's left over. Now, you do typically pay a monthly premium for that supplement. That's the cost there. And separately, you usually also add a drug plan to go along with that. But that is the trade-off that you're making here. A steadier, more predictable premium in exchange for fewer surprises when you actually have to use the care. Then there's Medicare Advantage, otherwise known as Part C. What you have with an Advantage plan is A, B, and D wrapped inside of a package that usually also comes with networks, which is a set of doctors and hospitals that you can go to without having to have any additional charges on top of what you are going there for. That said, you also may need to have referrals if you have to go see specialists specifically for any chronic conditions. Now, your costs here tend to come as copays as you go and a deductible that has a specific cap, or otherwise known as your yearly maximum out of pocket. The trade-off here is often a lower, sometimes zero, plan premium bundled with some extras and in exchange for working with inside of a network and a network of doctors and hospitals. That can also add more variability when you actually go and use your services. So, how do you decide? How do you choose what's best for you? The easy way is to ask yourself 3 simple questions. 1, do I want to stay with my doctors? Is there a specific specialist you'd really like to stay with and you would be in trouble going away from? If that's the case, then how your specialists handle networks matters a lot. Then number 2 is your medications. And what I want you to do here is make an entire list of all of the medications that you have and that you use frequently that also need to be carried over, because drug coverage does differ on each side of the road that you decide to be on. Then what I want you to assess is your comfort level with surprises. Think of it this way. Would you sleep better if you knew that everything that you needed in terms of your care was taken care of just by paying a simple premium? And specifically that you don't have to worry about anything regarding a network. You can go anywhere you want and all that kind of stuff. Or does cost matter more to you and you don't mind being confined inside of a network of doctors? Either way, make sure that whatever you decide you can actually live with 10 years down the line. So that, my friend, is the real comparison here. Not which one is best, but which one fits your overall lifestyle and how you want to live. Make sure that whatever you choose, that is how you actually decide which is better for you. But I will say honestly, if you take the time to do and answer those 3 questions very, very brutally honest, you'll make a choice that you won't have to regret again those 10 years down the line. And what I want you to do now is a favor for me, send this to someone who is juggling that decision at the moment. Hopefully this video will help them save some headache. But again, my name is Joel and I'll see you in the next video.